Mr. Sapeta, thank you very much for your time. Firstly, how should we show appreciation to nurses on this International Nurses Day?
Good morning to you, Kola, and the viewers. We are very excited in recognizing the contribution made by our heroes and heroines in the form of the nursing fraternity, because nurses are existing to save the world and nurse the world in terms of ensuring that they save the lives of our people. So today we'll be thinking about the hardship that the fraternity has gone through, but also key moments of celebration in appreciating that indeed from Mama Flora we have been done some great work in ensuring that we have this world that we have today.
Yes.
So today we'll be just communicating a message in recognizing that and drawing some inspiration for the future, particularly taking into account of the coronavirus that is an enemy today.
Yes. Now, this date, the 12th of May, that International Nurses Day is celebrated, it also coincides with the birthday of Florence Nightingale. In your view, how should the younger generation of nurses learn about this profession from people like Florence Nightingale?
You will recall her contribution is a very inspiring contribution, and I think that all of us, we should draw some inspiration and strength in our call to improve the lives of our people. So we have to learn lessons, because she took up upon herself to make sure that this fraternity is transformed and also is appreciated and recognized its contribution that is making in society. Because you will imagine that there are few people who understand and appreciate the contribution made by nurses to date. Generally, they are regarded as one of those who are employees, not necessarily as people who are nursing the world. So we do have to take into account of what Mama Flora was very advancing in society.
Now, the issue of personal protective equipment has been quite a huge talking point with the pandemic of COVID-19. So far, how satisfied or perhaps less so about how government is distributing these at public institutions and, of course, the private healthcare, where we've also seen some of the pitfalls?
To be honest with you, we are not happy at all, because to us the situation is the same. Just imagine the extent to which health workers have been infected by this disease. In fact, they are almost 2% of the overall national infection. You'll imagine that by the time you come to hospital for help, you won't find the nurses and the doctors standing there to help you. So we are not happy with the PPEs. In fact, from the data sent to us by the minister on the 8th April, we had responded and we have said that it's not a true reflection of the workplace. So we needed more, particularly at ICU and other medical areas at the hospital. You know, your N95 and the visas, those are the critical ones where it matters the most. So we are not happy, but we do recognize the efforts of government, but we think that we must do more.
Yeah, and it's quite interesting that we talk about this issue of personal protective equipment. The Minister of Health, Dr. Zweli Mkhize, was in the Eastern Cape just yesterday, and in Port Elizabeth, there were some health workers protesting there over the lack of this equipment, and some of them saying that they are being forced to use the same equipment repeatedly when it actually says that that equipment should be thrown away at a particular time. But I want to talk about this particular question with you now. We saw the St. Augustine's Hospital in Durban, and I think alongside Kingsway, which belong under the Netcare Group, reopening their doors yesterday. How satisfied are you that protocols at these two institutions are going to be observed going forward, given the cases that have come from those two healthcare institutions?
Remember, Kola, we have been promised as the nation of an investigation that is undertaking there, precisely because of the number of infection. To date, we have not been given, the findings of that investigation.
How could
Yet
you
we are
allow for
expecting-
how could you allow for the two institutions to be reopened then? Because surely this would have been in consultation with the provincial government in KZN.
We are not allowing it at all. We have not been consulted. Our structure in the province had reported to me that they are still waiting for the report, and they are told, they are told by, not necessarily being given a respect and a dignity to take them through on what has been found in a manner that all of us were satisfied to go back. But we are not happy, and we are to find a way of talking to our members, because our position is quite clear. No PPP, no PEE, no PPE, no work. And if they are subjected to that, it will be unfortunate. But this is not really what we're thinking about. We think that all of us must hold our hands together and confront the disease. But if we are subjected to a point where we must encourage our members to withdraw their labor, we will do so.
Mr. Sapeta, I think just to make your point clear, and very briefly, please, are you saying that these two hospitals, St. Augustine's and Kingsway, under the Netcare Group, should be opened or should not be opened?
We will not risk and say they must be opened. We need the investigating report to recognize what created or resulted in that situation. And upon that, we must together make measures to save lives of our health frontline workers, together of the community. But anything less than that, we will never support the reopening.
All right. Thank you very much for your time. Well, there you have it. And, of course, talking to us this morning. And I think we probably are the first to get you this information that at least one of the biggest unions in the country in the health sector is saying that St. Augustine's and Kingsway in KZN should not be reopened. We saw those two institutions opening their doors yesterday.